Welcome back to Decode Healthcare with Harshal. After conquering wound exploration and injections in Part 1, we are taking things to the next level. This explainer tackles the intense, complex coding rules for reattaching severed limbs and bone grafts. Let's just dive right in and decode these procedures together.
First, let's ground ourselves in the CPT book. We're moving away from those basic injections and wound explorations we covered previously, and we're heading straight into some seriously high-stakes surgical procedures. Today, we're locking our focus specifically on codes 20802 through 20999. This is where medical coding gets incredibly intricate, and, precision is just absolutely everything. Here's our agenda for today's explainer. First up, replantation. Next, grafts and implants. Then microvascular anastomosis. And finally, a quick teaser for Part 3.
All right, Section 1, replantation or reattaching severed limbs.
To code this accurately, you really have to understand the clinical definition here. Replantation strictly means reattaching a completely amputated body part, like say a thumb or an entire arm, using advanced microsurgery to reconnect those tiny nerves and blood vessels. And it is absolutely crucial to note that this is vastly different from just repairing a partial amputation. If that body part is still attached by even a tiny, tiny bridge of skin or tissue, you're coding a repair, not a replantation. Just look at the complex anatomy of the hand here. Visualize the surgeon's goal. They're working with a completely severed thumb. The surgeon is peering through a high-powered microscope, literally suturing microscopic arteries, veins, and nerves back together to restore blood flow to a completely detached part. It's an incredible feat of medicine, honestly, and your coding needs to reflect that exact level of complexity. So the crucial point here is that CPT codes 20802 through 20838, which you'll find right on page 135 of your CPT book, are specifically categorized by the exact anatomical site of the completely severed part. For example, you're going to use 20802 for an arm, 20808 for a hand, 20824 for a thumb, and 20838 for a foot. As a coder, you just simply follow the anatomy right there in the operative report to select the correct code. Okay, moving right along to Section 2, bone, cartilage, and fascia grafts. Now, before we code this, we need to know what a graft actually is, in plain English. Imagine you're rebuilding a broken wall and you need some extra bricks. A graft is essentially just taking tissue, whether that's bone, cartilage, or fascia, from one place on the patient's body, the donor site, to build up or repair a defect somewhere else, which we call the recipient site. And this illustration right here perfectly captures the golden rule you need to highlight in your book right now. If you look at the CPT guidelines for obtaining grafts on page 135, the text gives us a fierce, absolutely non-negotiable rule about when you can actually bill for harvesting these materials. Never, ever hallucinate this rule. Read it straight from the CPT guidelines. Bone, cartilage, and fascia grafts are only coded separately if they're harvested through a completely separate skin or fascial incision. Picture this. If the surgeon is operating on a knee and they just shave off a bit of bone from that exact same open knee wound, it's bundled. Do not bill it. But if the surgeon makes a totally separate cut into the hip bone, like the iliac crest, to harvest bone to fuse the spine, then you absolutely bill the harvest code. Separate cut equals separate code, period. So, when you're looking at a complex bone graft insertion like this one, you must always ask yourself while reading the operative report, where exactly did this graft come from? If the surgeon took the autograft from the exact same open wound they were already operating on, the harvest is entirely bundled. If you bill it, you're gonna get a denial. You've got to keep that separate incision rule burned into your memory. All right, Section 3, microvascular anastomosis decoded. When your operative report throws the term microvascular anastomosis at you, you need to translate that medical jargon in your head into something much simpler. Think of it like plumbing. It literally means sewing tiny microscopic pipes, the blood vessels from the graft, directly into the blood vessels of the new recipient site. They do this so the new bone gets an active blood supply and, well, doesn't die. Now, because the surgeon has to physically disconnect and then meticulously reconnect that blood supply under a powerful microscope, this is coded completely differently from a standard bone graft. Here's how it works. First, they harvest the bone, being super careful to keep the original blood vessels intact. Second, they move it to the new site. Imagine taking a fibula bone from the leg and moving it all the way up to reconstruct a shattered jaw. And third, they sit under a microscope and painstakingly sew those tiny arteries and veins together to keep that bone alive. For these highly intricate, free osteocutaneous flap procedures, which you'll find on page 137, Your coding selection depends entirely on where that graft was originally harvested from. If the surgeon took the living bone from the fibula and the leg, you're going to use 2955. If they took it from the iliac crest on the hip, you use 2970. It's that simple. You just follow the origin of the graft to ensure flawless coding.
And finally, Section 4, a quick teaser for the head codes. So in Part 3 of this explainer series, we're heading straight to the skull to tackle codes 21010 through 21499. We're going to break down everything from severe jaw fractures to massive cranial reconstructions. The anatomy up here gets seriously fascinating. So, the big question I'll leave you with today is this. Are you ready to decode complex facial reconstructions without costing your practice thousands in bundling errors? Make sure you subscribe to Decode Healthcare with Harshal so you don't miss Part 3. And hey, keep that separate incision rule burned into your memory. Keep learning, keep decoding, and I'll catch you in the next explainer.